Hi, everyone. Welcome. Thanks so much for joining us today. As we get started, we're going to let people trickle in, but as we get started, I'd love to know where everyone is joining us from. So take a moment to introduce yourself in the chat and let us know. I'll start. I'm Karin Saucedo. I'm the Texas State Coordinator for Project Coyote, and I'm joining you from the Dallas area in Texas. Um, and before we begin, I have a few housekeeping notes. Today's webinar is being recorded, so we'll send out the link to the recording so everyone who registered will be able to view it again and share it with others. Also, we're going to have you guys hold your questions and put your questions in the Q&A section, and we will answer questions at the end. We'll save time for the end to answer questions. And also, I'd like to thank our speakers for being here today and for sharing their time and expertise with us. At Project Coyote, we get so many questions from people who encounter wildlife affected by mange. People want to understand what they're seeing and what they should do. So we wanted to bring together experts to help us understand and answer some of those questions with clear science-based information and practical guidance. So this topic is very personal to me. Photographing a coyote with mange in a local nature preserve is what first sparked my interest in coyotes many years ago. Back then, I had questions too, and I wanted to understand what I was seeing. That experience eventually led me down the path of studying coyote behavior, wildlife rehabilitation, and eventually joining Project Coyote. So that's why today's discussion is especially meaningful to me. So before I introduce our first speaker, I'd like to share a few resources. Project Coyote has a large collection of downloadable educational materials that provide communities with clear, science-based information and practical tools to help protect and coexist with wildlife. They are free and you can use them and share them with your community. You can scan this QR code and it'll take you directly to those resources. And we recently added this 3-page Mange fact sheet that you can download and share with your community. I also encourage you to join Project Coyote's e-team if you haven't already to follow our work, and you'll receive news, educational updates, and opportunities to take action in your state or region. Here's that QR code as well. And of course, if you want to make a donation to Project Coyote to help support our work to protect wild carnivores, here's that QR code. Amelia is helping us behind the scenes to make sure this webinar runs smoothly, and she'll be dropping all of these links into the chat for your convenience. So let's get started. So mange can be a devastating disease, but it doesn't have to be a death sentence. Many animals can recover with the right intervention under the right circumstances. And this is one of the coyotes in my neighborhood who was able to be treated for mange back in 2020. His progress was well documented, and you can see here what a big difference it makes. In fact, he's still alive today. So now I want to show you another coyote. This is typically the type of photo that gets shared on social media. And it's understandable how an image like this can lead to fear if you don't know what's happening or even what you're looking at. This is the same individual an hour later, and you can see more detail here. And again, the same coyote, just a closer portrait. So you can clearly see that he's a coyote dealing with an advanced skin condition. When I first saw a coyote that looked like this, I had so many questions, and I wanted to know more. So that's one of the examples that came to mind as we planned this webinar. So now I'd like to introduce our speakers. First, Dr. Jaime Rudd. She's the Species Research and Recovery Program Manager at the Center for Natural Lands Management. Jamie's a wildlife health specialist with more than 15 years of experience in disease ecology, pesticide exposure, and wildlife conservation. Her research has focused extensively on sarcoptic mange and wild populations, including coyotes, red foxes, and endangered San Joaquin kit foxes. She spent 12 years with the California Department of Fish and Wildlife before joining the Center for Natural Lands Management. Dr. Rudd will share a research perspective on mange. Next, Lisa Fosco, Director of Animal Care at the Wildlife and Needs Center, and she's an advanced wildlife rehabilitator. Lisa is a licensed vet tech, wildlife biologist, and certified wildlife rehabilitator with nearly 40 years of experience in wildlife care and wildlife rehabilitation. She's managed major wildlife centers across North America, and she's taught professional wildlife medicine and rehabilitation for more than 20 years as an instructor for the International Wildlife Rehabilitation Council, with a career-long focus on North American canids and the effects of mange on foxes and coyotes. So Lisa will provide a veterinary and wildlife rehabilitation perspective on mange. Okay, Jaime, I'll stop sharing and then I will pass it over to you.
Great. Thanks, Karin. I appreciate it. And thanks, everybody. I appreciate your time joining us today to talk about a really important issue that I'm sure a lot of you might have seen or experienced, but also even just seeing the pictures of can be pretty devastating. So let me get my screen here in order. Give me just a second. Let's see. Okay, I think I'm there. Let's see. Okay. Hopefully everybody can see that.
It's showing the notes. It's not full screen, it looks like.
Yep.
There you go.
Is it full screen now?
Yep.
Perfect. Okay. Yeah, thank you again for that introduction, Karin. And my background is wildlife health, especially with listed species. And I am coming from California, where I was a wildlife health specialist with the California Department of Fish and Wildlife. So I have seen the whole sort of gamut of species that unfortunately mange can infect here in our state, which recently included the San Joaquin kit fox, starting in 2013. So I was just going to provide just a brief history today, a little bit about the epidemiology and the research of this disease, which is actually found worldwide. And the first question a lot of people ask, essentially, is what is mange? There are different types of mange, but essentially, in general, it's any sort of skin condition um, that affects animals and people. And this includes things like scabies and other mites. I have an image here of a couple of different mites. There's hundreds of different mites that can cause some form of mange. Um, Demodex tend to be very common, especially in domestic animals. I don't know if anybody's had any of their dogs. Sometimes they can get Demodex mange, which is a self-limiting disease. It's not infectious. There's also ear mites. If anybody's adopted or fostered any kittens, often little kittens can get ear mites. As well as Sarcoptes scabiei, which is the only mite in the genus Sarcoptes. But it's a large order of mites that we have seen. And so here again, it's just a couple of different mite species and their common hosts. Some infect people, some do not. And we're going to focus on Sarcoptidae and in particular Sarcoptes scabiei, which is typically responsible for what we call sarcoptic mange. Just note that there are other manges, like bobcats tend to get notoedric mange. Coyotes can also get Demodex mange, and I believe Lisa's going to go into a little bit more detail about that. Sarcoptes scabiei and sarcoptic mange in particular is of a concern because it's highly infectious and it's got high what we call epidemic potential, meaning that it can just kind of burn through a population rather quickly and infest a lot of individuals sort of at one time or within a couple years' time. And it's also considered a zoonotic disease and a reverse zoonotic disease. So people could potentially get it from animals, often people that are in close quarters with like a dog or a cat that might have Sarcoptes scabiei, as well as people could potentially also give it to to animals, and we'll talk a little bit about that and maybe the origins of how it found its way into wildlife. For people, it's often called scabies. I don't know if anybody's heard of the itch or the 7 years itch. That is essentially scabies for people. It's one of the oldest diseases that we actually have a known etiology for. So it's actually one of the first diseases in which we know what the cause is, which is Sarcoptes scabiei mites. It's thought that Napoleon actually had itch his entire life. And the disease in people can sort of manifest in various ways, whether it's this itchy red rash and bumps, or sort of this plaque formations that we often see in a lot of wildlife. The mite itself essentially has this 10 to 14-day life cycle in which a female lays a lot of eggs. Those eggs hatch into various larvae and nymphal stages as they get bigger and shed their exoskeleton until they're of reproductive age. And this is really going to play into interventions, which will be discussed by Lisa later in this talk. And so this mite burrows into the skin, and essentially our skin is our first line of defense. So it's actually really an important part of our immune system is our skin. And so when that skin barrier is broken, that can cause all kinds of problems. Sarcoptes scabiei mites, in particular for sarcoptic mange, is a primary obligate pathogen. And what I mean by that is that it has to live on a host in order to reproduce and survive. But it can also infect and sicken healthy individuals, as well as individuals that might have an underlying condition. So, unfortunately, any healthy animal is susceptible to this parasite and can become sickened and weakened and then die from the infestation. And again, it's the essentially the agent that causes sarcoptic mange. And so we'll be really specific when we talk about Sarcoptes scabiei and sarcoptic mange, and not just mange kind of in general. Often in people and in wildlife, we see these epidemic waves. So we see peaks of epidemics every 7, 10, 15 years. And for wildlife in particular, it's usually fatal without intervention. Research has taught us, and there's been a lot of research on Sarcoptes scabiei in particular due to its zoonotic potential, especially with laboratory studies in coyotes and red foxes, is that it's often considered a disease of crowding. And even in people, we see often infections in hospitals, schools. For animals, it spreads through direct contact. So it moves really quickly through shared spaces. So animals that might share dens, have high familial social behavior where they live in these large familial groups, which some canids do, as well as some other organisms, and also high densities. And so what we're finding with our research is that the density of the animal is really important in the spread and the continued transmission of the parasite. And when those densities get low, transmission slows down and we don't really see as many cases. And then once those densities get bigger and higher, then we start to see these epidemics. And so the epidemics kind of seem to sort of rely upon the host's ability to reproduce and sort of come back up. And the population recovers before the infection really just spreads again. The more contacts, the faster it moves. And so I have kind of like a little contact node here with this, the red dot sort of being an infected individual. And for highly social animals, you can kind of see that nexus between all those interactions are potential interactions for mange transmission. Laboratory infections during controlled studies with rabbits, coyotes, and red foxes just show how the disease progresses. And so it's also what we call, oops, I'm sorry, a progressive disease, and that in order to get the really nasty sort of bald cases with those crusts, they kind of start off with just really minimal lesions that often people don't see, or you might just think is typical shedding, until, depending on the size of the organism, anywhere between 90 to 360 days later, you get these really severe lesions. We also know that direct contact is sort of the most common way that organisms are infected, but there's also indirect transmission as well. So these mites can live off their host and still be infectious for about 3 to 5 days. So for something like a kit fox, which is an obligate denner, so it lives in a den year round versus coyotes just might den during the breeding season. Those dens, we've actually measured the temperature and humidity to show that they can actually promote off-host mite survival for a couple of days. So that also promotes transmission. We also have animals using patio furniture outside, and so they just are dropping these crusts and these skins just full of infectious mites that another animal could come and potentially become infected with. What the mite actually does to the host is essentially upon initial infection, there's like this latency period where there's really no clinical signs. And the host isn't even itchy, it's not scratchy, but as the mites tunnel into the skin, they secrete these enzymes to help sort of digest the proteins in the skin so that the mite can absorb them. And the mites are also laying their eggs, they're defecating, and these digestive enzymes start to irritate the skin. And so these lesions that we see in the skin with the thick crusting, the breaks, the hair loss, that's really an attribution to this overreaction of the immune system and what we call like a hyperactive response. And so those mite antigens, those the eggs, the secretions, and the defecation really drives most of the damage to the skin through this overreaction of the immune system. A lot of wild animals also have no lasting immunity, and laboratory studies have shown that while initial infection for the very first time might take maybe like a month or two for an individual to start to show signs, if they're treated, successfully rehabilitated, and released, a lot of these animals, the second time that they're exposed, that infection sort of like is an allergic reaction. If anybody's had any poison oak or poison ivy, that immune memory happens really quick. And so those animals actually start to develop clinical signs much, much more quickly. Um, and unfortunately, they just don't have lasting immunity. And so we do see a lot of reinfection in various animals. And it just causes this chronic decline to the point of you've got just this poor bald animal that's probably very miserable. It's itchy, it's crusty. For nocturnal animals, that can change their behavior. Studies on coyotes have shown that they'll actually actively seek out areas where there's people because there's more resources, there's more shelter, there's more food that's easy to get. And even their behavioral patterns might change. They might be coming out during the day more. They can't thermoregulate. They get secondary infections that they often perish from before mange, or it just leads to emaciation. Mange outbreaks in wildlife occur across about almost 150 animal species. So I think right now the count's at 149 different mammalian species of domestic and wild animals. Um, Introduction was first thought to actually have been from people to dogs when dogs were domesticated, and then from dogs to wildlife. And so, really, the introduction into wildlife has been more recent than perhaps domestic dogs, which might be why domestic dogs they still have a problem. And they still require treatment when they have sarcoptic mange, but they tend to live a lot longer or maybe spontaneously recover. For wildlife, we just don't see spontaneous recovery. Most wild animals don't recover on their own. They do require intervention or they die. Other species that we have seen actual population level declines associated with the disease are red foxes, the Siberian ibex, which is a type of goat and found in Spain, various species of wombat in Australia, coyotes, and now San Joaquin kit foxes, where about 68% of our kit fox population living in Bakersfield, California, has actually declined in the last 10 years due to sarcoptic mange. Mange is also very familiar in American history, and it was actually used deliberately as a form of pest control to eradicate wolves, coyotes, and red foxes in the United States. And that includes areas like Yellowstone, in Montana, as well as even parts of Texas. Karin was able to actually find some newspaper articles from the 1890s discussing deliberately infesting wolves and coyotes with sarcoptic mange and distemper through infected domestic dogs. And essentially, they would trap these animals and then have them in close quarters with an infected dog or the carcass of a dog in order to transmit the mite. So we know this mite has been deadly and fatal in wildlife for a really, really long time, and probably even longer than that. But these are kind of just the first articles that came out about this. And it's actually one of the reasons that in certain areas in Yellowstone that they're having a difficult time being able to recover some of the wolf populations because it has spilled over into red foxes and coyotes. And so introducing wolves back in certain areas, it's just going back to wolves. And so it's a population limiter in that these individuals, the population sizes can only get so big before the densities are so high before that transmission really takes off. And I've just got a few more slides left here. What I found in my studies, which complements a lot of other studies in Europe, as well as in Australia and even in other parts of North America, is that while the mite circulates broadly within the same species, within a community of different species, we might only see clinical disease in a couple of different hosts. And some of that comes from what we call this host associated variant. So um, it can be difficult essentially for the mite to maybe infest a novel host and cause infection unless there's just prolonged continued contact. And that's where I think coyotes might come into play here with mangy coyotes continually coming into contact and interacting with other individuals. And at some point, we might get a genotype of mite that is really successful in a new species. And then we start to see this epidemic take off in just a completely new species, eventually over time through these prolonged contacts. And so this is a little graph called a PCA, and essentially it's just showing that there's geographic differences. So we found differences in mites that came from coyotes, maybe in different counties or cities in California, versus those that, multiple coyotes that came from a certain area. So there was sort of little overlap in those areas. So we can actually say regionally where a mite actually be from, um, as well as the host species that it's infesting. So essentially, these host animals and these species so for us, like a coyote, maybe in Ventura, California, is its own little island and separated from a coyote in Bakersfield, California. And so we can actually kind of see how the mite might move through the system that way. And then lastly, I'll kind of start to end it here. Just kind of with sarcoptic mange in wildlife. Again, it's a human and domestic animal health concern as well as for wildlife. We don't see spontaneous recovery really at all in most wild species, which is why then we see these population growth and recruitment um, of individuals in a population to see the stagnant growth. We also find that it's really difficult to eradicate once it's been established in a new species or in a population, even with treatment and rehabilitation. And recent evidence also suggests that the disease alone is capable of driving populations and species to extinction. And then lastly, before I hand it off to Lisa, is we do see other diseases that can look really similar to sarcoptic mange, including other mange mites. And that's important because that's going to impact treatment and the welfare and well-being of this animal. This little bear was brought to the California Department of Fish and Wildlife after it was unsuccessfully being treated for sarcoptic mange. And unfortunately, a veterinary examination wasn't done on this animal, and it actually had a fungal infection. And so those plaques you see is from like a ringworm infection and not from a mite. And that's, again, really important when we talk about treating animals and the welfare and well-being of those animals. So other diseases, other mites, and even fungal infections can sort of mimic what sarcoptic mange might look like. And so it's really important that we get it right. And with that, I've got some email contact, and thank you very much. These are some San Joaquin Kit Fox puppies that are healthy, living at a college campus in Bakersfield, where we have seen sarcoptic mange sort of sweep through the population.
Awesome. Thank you so much. I love those little foxes. They're so cute. Awesome. All right, Lisa, are you going to share your screen or do you need me to do that? And you're muted.
There we go. Let's see. So tell me if you can see this. Ooh, let's get away from. Okay. Can you see that okay?
Not yet.
Oh, great. Okay, please hold. Okay. Let me see. Sorry. We are having problems here. Okay, try this one. How about, can you see that?
Yes, I
There.
see your notes on the left side though.
Okay, so let's see. Get away all these things. I'm just trying to do. Okay. So how about if I go away? How about if I do this? Do you see presenter view or regular view?
It's a regular view, not presenter view at this point.
Okay. So this works?
No, we're seeing your notes on the right side.
Okay. Let's try this one more time.
Okay.
Okay, screen share. I will shut this off. Okay. So left up here. Maybe we need to do yours. Okay, I will try screen share one more time.
Okay.
How about now?
I still see the notes on the bottom left, but
Really? Okay.
yeah.
You see my notes on the bottom left. Go away. I don't know how to make this panel go away. Sorry, guys. How do I do this?
I can share it.
Why don't you share yours?
Okay.
Almost the same.
Yeah. Okay, if you'll stop.
Sorry, guys.
No worries.
I really wanted to share this normally. Okay, we'll have to do yours.
Okay.
And so I can't forward anything, correct?
Right, you'll just tell me when to go and I'll just go.
Okay. So my computer is completely frozen, just FYI. I don't know why. Okay, there we go. So can you go back one? I can now see. Okay, forward, please. Sorry, guys. Okay, forward, please. Thank you. Okay, so there's a couple different types of mange, and Jamie hit on a lot of these already. I'm going to talk really quickly about the other options just because we are focused on coyotes, which almost always is going to be sarcoptes or sarcoptic mange. So this is just a little bit of you can see the difference in the mites. Go ahead forward, please. But really what we're going to be looking at specifically today is going to be sarcoptes because that is what we see in our coyotes. Oh, thanks. So when we look at these guys, basically what they do, and if anyone has ever had the misfortune of actually getting mange, you'll find that you can feel every little mite that burrows through your skin. So basically what happens is that the mites burrow and form tunnels in the outer layers of the skin. The females are going to go through these tunnels and lay eggs all through the tunnels, which are going to hatch in about 3 days. It's going to depend on temperature as well. So there is a little bit of a variant based on the outside temperature. In warmer climates, it's going to be a quicker process. And then what's going to happen is the larvae are going to start to tunnel as well. And once they develop into nymphs, that's really going to accelerate the process. So the more development that they have, the more tunnels that they create. So they can have a very low grade infection where they just have a little bit of baldness, a little bit of crustiness on them, and it stays that way for quite a while. But then once it starts to accelerate, it accelerates really quickly. And people will see this. They'll see a coyote out there that they have seen for a while, and then all of a sudden it becomes a really big problem, especially in colder climates. They are losing fur. But this is where the process can really accelerate. It takes the nymphs about a week to become adults, and then the process just, again, accelerates. Now, I don't think, go ahead, forward, please. I don't think that you can see this on your view, but what this is supposed to be is it's a video showing the actual mites going through the tissue. But sorry for the IT problems because you cannot see it in the PDF. So when we get these animals in, and I work in a rehabilitation setting, so typically what my role is going to be determining how we get them in. So if somebody has one, can we trap it? How can we get it? Are we going to get it in for treatment? Does it have a family? Is it a parent? What time of year is it? Is it one that's in a pack? Is it solitary? Trying to figure out all these things before we figure out exactly how to trap it. Once we trap it, if there's any fur loss, we always do diagnostic testing with them. And what that means is that we take a skin scraping. So basically we take a blade and we take off the top layer of the skin, which is where the mites would be. We go down until a bleeding layer, so it's a little thick. And then we look at that on a microscope and determine what is going on. Now, Jamie made a really good point earlier that we do have situations where we have alopecia, fur loss, crusty skin, things that do look like dermal or skin issues that are very consistent with mange. That does not necessarily mean that they are mange. Unfortunately, from the perspective of rehab and caring for these animals, I would say in my personal experience, about 50% of our skin scrapings are positive, even on the animals that are extremely infected. So typically what most rehabilitators will do is we will scrape them, but if they have the symptoms, we will treat them regardless of whether or not we have a positive skin scraping. There have some situations where vets, especially new vets, have done the skin scraping, found it negative, and re-released those animals without treatment. We would never want to do that because the chance of catching them a second time is just that much more challenging. So we do recommend treating based on symptoms, considering how safe the drugs are. Go ahead. Thanks. So I can give you a minute just to kind of look at this, but basically transmission is going to be based on different things. It's going to be based on the immunocompetence of the host. So do you have a healthy coyote or do you have a sick one? Do you have a geriatric or pediatric one? Just really looking at their immunocompetence, and then the virulence or strength of the mite strain, and also the environmental condition. So if you're in a situation where you're immunocompromised and it's in the winter and you start to lose fur, you start to lose insulation, that is going to get bad very quickly. Direct contact is almost always how we get it and how they share it, but they can also share it through indirect contact, and that can be shared on anything. So when we say it's an exposure to a fomite is anything. It can be a surface, it can be a leaf, it can be a rock, it can be anything. So when we look at something like a coyote, whose natural social structure is to have communal groups and a social system, and then with more than one animal, it is very, very easy for a mild infection to go through an entire pack or an entire group very quickly. Now, the other concern that we have, which is a little aside from this transmission information, is now that there is such widely used rodenticides, or so much rodenticide use, that has become a really big issue with implicating animals such as coyotes and foxes and squirrels, and the ones that do get pretty severe mange, because it is a direct hit to their immunocompetence. And so if you have something like an area where there's low-grade mange, they may or not get it, and you have healthy animals, that's one thing. But when you start introducing rodenticides into the population of the food that they eat, that is where we're starting to see some really major changes with regard to how impactful it can be with rodenticides in combination with mange. So that's a concern. And anything that they share, if they are not treated, would be considered a fomite or a potential for transmission. Switch. Cross-species concerns, I'm not going to talk too much about this. If you do work hands-on with these animals, obviously take precautions. There are some pretty good studies out there that show certain types of experimental infection, but one of the interesting things was that when we looked at sarcoptic mange in coyotes and other canids, it does transmit and it does infect other species. It is much of a less extensive infection though. The gray fox was the one that had the most resistance, which was interesting because the red fox doesn't elicit immune response. So it was kind of, gray foxes, red foxes aren't that similar, but this is another area where we seem to see that. We did not see, when we looked at these studies, any evidence of any studies that showed some actual infection that could be produced in these species that you're looking at here when we looked at the red fox or coyote type of mange. So just note to self, it's going to be a big problem for coyotes. It's probably not going to be that big of a problem for these species that are listed here, which overlap in most areas of coyote habitat. So typical clinical signs are going to be fairly straightforward. You've seen a couple pictures now, so you know what this looks like. Skin can be anywhere from just a little bit scaly to a total solid thick crust. They do have a scent to them because it's very yeasty. So once you kind of smell this, you don't forget what this smells like. And we get situations where we might get a fox or a squirrel or a coyote and that has severe mange. We know what it is before we open the box. That is how strong that odor can be. Skin lesions can be really bad, and the worst places that they tend to get them is on their face, specifically their ears or the pinna of their ears, and any of the unfurred places, so around their eyes, around their lips, underneath their ears, their genitalia. And then also, they're going to have a lot of problems. If they get it really bad, they'll get fungal issues in their feet. As far as the skin lesions, if they get pretty bad mange, they'll also get 2 ulcerations, one on each of their dorsal hips, where your 2 hip bones pop up. That skin will actually degrade and they will get lesions there too. It's not a problem with treating it. It's like anything else. It's just a severe infection. We treat the animal for the mange and we treat the wounds for the infection. So it doesn't change anything. It's just a more severe infection. So it can happen anywhere on the body, but specifically we tend to see it on those areas. So with regard to the actual functionality of these animals, mange in itself is not the biggest problem. It's not going to kill a wild animal in itself. What's going to happen is that they're going to have problems with exposure. They're going to have problems with caloric intake because their body is fighting something. They're going to be further immunocompromised, which is going to make them very vulnerable. But also one of the bigger problems is that because the crust gets so thick on their faces, it will actually get to the point where they can't see. So this is where, the crust gets so thick on their eyes, they can't see, so thick on their ears, they can't angle sound, and that will affect their ability to hunt because they can't hear, which is one of the main tools that they use to find food. And then when it comes to red foxes, I really do want to separate red foxes from coyotes because red foxes are a whole different ballpark in that they do not elicit the same type of immune response. Coyotes do. So if a coyote is in very good condition and they don't have an environmental impact working against them, like the middle of winter, there are animals that do come through it. I don't tend to see them because I'm a rehabilitator, but there are cases where they do come through it. And as Jaime said, it's going to be far and few between, but it does happen. Go ahead, forward. Thanks. So looking at the immune response, excuse me, looking at the immune response, when it comes to a parasitic infection, the body has a certain strategy to attack it. The eosinophils, which is one of the white blood cells that tends to be one of the agents that goes against parasites, is going to be one of the first to acknowledge this type of infection. So when we look at the mammals that can launch an immune response, 40% of humans can do it by themselves. So if you were to get human mange, the human strain of mange, you do have a chance to fight it on your own. 80% of domestic dogs. I found this in a study. I was kind of surprised to see it that high. But there are several studies that confirm that 80% of domestic dogs do have an immune response that can get them through a moderate infection of sarcoptic mange if they are immunocompetent. The biggest problem that we have working with coyotes is because we're going to treat them, get them in better condition, and then release them back into their natural home, they're going to go right back into that den, and they can go right back in there with other animals that haven't been trapped and treated. So reinfection is going to be a concern. If they've had it before, they've got a better chance at fighting it just because they have an immune response to it. But it's still a very big concern with treating these animals and releasing them. And I'll talk about that a little bit more in a few minutes. So this is a really interesting, and this is not a fox or a coyote, this is a fox. But I don't know if you guys have seen this. This is a really interesting thing. This is a woman that has a bunch of foxes on her property. She watches them, she feeds them, she loves them, she knows them. And what happened was a bunch of foxes used to go under her fence. That's how they got through it. Well, she started to see mange in her foxes, all except for one. And the only fox that she had that had fully intact fur would not go under the fence. He would only jump to the fence and climb over it. So somehow, some way, the belief is that this fox knew that they had mange. He knew where the scent was from where they had rubbed, and he made a very clear path to avoid it. So this is one of the things a lot of us that kind of keep up on what's going on in the world of mange. This was a really interesting one for us because just she had enough video documentation to make this very, very suggestive that that was what was going on. So throwing that in there. Absolutely, causation versus correlation. Okay, so in coyotes, these are the complications, like I said, that we're kind of looking at. So exposure is going to it's really going to depend on the temperatures and the degree of fur loss. Obviously, they need that insulation. Without it, the outdoor external temperatures could be a concern. Secondary complications are always going to happen when this is a severe infection. Again, if you have a very immunocompetent animal, they're going to get through this a lot better. If they're severely immunocompromised, it's the secondary complications that are going to be the problem. And, starvation and failure to thrive. At the end of the day, when it comes to wildlife, we know how this goes. It does come down to survival of the fittest. So when we talk about immunocompetence and we talk about how they can elicit this immune response, this is going to be a big deal. So starvation and failure to thrive are going to be really a big concern for this. But, again, if we can trap them, if we can get them, if we can treat them, this is one of the few things that we see in wildlife medicine that is so easy to treat. So that's one of the benefits. Okay, so just kind of understanding that because they can produce antibodies more effective than other things, that does lead us to consider the concerns for asymptomatic carriers. And again, some of these animals will have been infected before, so they have an immune response. So they can carry a pretty low-grade infection. They can carry a couple of mites, or they can be asymptomatic and just carry it. So this is going to be a concern, again, for communal species. Hypersensitivity, when they're immunocompromised, again, this is going to be lethal. The same way fleas would be. You can have a couple fleas on a dog, but if that dog is in really bad shape, fleas can be the deciding factor. Pruritus, meaning extreme itching. This is going to be something where we really do not really comprehend how much they itch. And if you've watched these guys, and I've worked with so many of them, they come in and they're miserable. They look horrendous, especially the ones that are extreme. You give them the treatment, and within about 45 minutes, they're resting comfortably. I can't sit here and anthropomorphize and tell you how they feel, but what I can say is that there is an absolute observable difference in their comfort. And so that's one nice thing, and one of the perks about getting them in is at least we can provide them some relief while they're healing from this disease. Secondary concerns can be anything, and again, that's really going to be aimed at the less immunocompetent individuals overall. So treatment and rehab considerations. So if you look at this guy in the picture, this one, this is not my picture, but looking at this one was very interesting to me because if you look at his neck, that is typically what we see with notoedric mange. That is very classic in other species of notoedric mange. I have no idea if this is it because it's not my animal, but this is not a typical presentation that we would see. When you look at the ears, the pinna around the face, that is very typical. When you look at the body, that is really not as bad yet because it's not completely full of crust. So you can see that there's fur loss. You can see that it's starting to crust up, but his ears and face are really the worst part. And you can kind of see it going around his body. Okay, so treatment and rehab concerns. There are many different products out there to treat them, and most of them are very effective. I really do want to say that while there are a lot of things that you can use, please make sure that you are considering the humane welfare for the animal. They have been through a lot. Coyotes are extremely shy. They get extremely stressed. I find it much harder to keep them in a good humane situation than I do foxes, just because of how scared they are. So I would really, just personal opinion, I try to steer clear of anything that involves bathing them, just because of the handling and the time that it takes. It takes a couple seconds to give a shot and several full baths to have the same coverage. So there are some procedures and some products that you can use with bathing, but the drugs that are used for this type of situation work very effectively. So it's not very common anymore that people would use a topical or a soap. Okay, so common things that are used to treat this, and I will tell you that I'm not going to give doses or give anyone medical information to how to treat these animals on their own. You do need to be working with a veterinarian. That said, there's very common things that are used for these guys, and they have different purposes. Ivermectin is one of the, that's the empirical first choice. It works very quickly. There are people that have kind of taken some shortcuts with it, giving it orally, giving it topically. This drug is designed to be given injectably, and that's the way that it should be given with regard to mange, because if you miss one drop, that is going to work against you in healing. I have had situations in the past, and one specifically where I had 9 coyotes. We had 2 parents and 7 kids, 7 cubs, pups, new species. And so what happened was we treated all of them, and they were very, very bad. Like, we had to trap the whole family. So by the time we got the last ones, they were pretty bad. 8 out of 9 of them just immediately started turning around, and one of them didn't. And I really do think it's because somehow when we gave that injection, it just did not get through the crust of the skin well enough. Second dose, he did great. But the first dose, that was one exception that I've seen, and I've seen that a handful of times over the years. Selamectin, which is trademarked as Revolution, is another good one. The advantage to using Revolution is that if they do have heartworm, additionally, which coyotes can have, Revolution is safer to give them. That said, that's really the only main benefit. The problem with doing selamectin is that it's got to get through the skin. So if you give selamectin on a very, very crusty animal, the absorption of that drug is not going to be as effective as an injectable one. And then the last one is Fluoroliner, which is Bravecto. This is now our go-to. And the reason for that is that it lasts anywhere from 2 to 3 months. So when I talked about in the beginning, our concerns for putting them back out in the wild and getting reinfected in their nest, this is the drug that gives us a little bit of comfort in doing this. So there's a lot of different ways that people will treat them. There's a lot of different protocols. I am more than happy to share mine if you're working with a vet and you reach out directly. But what I do have to say is that when you give Bravecto, we typically will give this the day before or the day that they leave so that we have as much coverage as we can for when those guys go right back. Oh, you're coyote, that's cool. We want to give them that coverage for when they go back to their den. Oh, I keep trying to change my slides, but okay. So rehab considerations and release. So, again, these guys look so bad when they come in. They look really bad. They feel really bad. They've been through a lot. They're starving. They're exposed. There's so much that they've gone through, but it is truly one of the easiest things that we treat. They feel remarkably better after one injection or one treatment, which again is a really nice thing to have. The different mite types of drugs, anti-mite types of drugs, are very effective, and supportive care is helpful, but the drugs do their job. The animals typically recover uneventfully once they're stabilized. What I have found, because we get some pretty bad ones, is that if you can get them through the first 72 hours, they do really well. Depending on the weather, we used to, in the old days, we would keep these animals till they had their full coat of hair. Problem is they grow it back much slower in a stress situation, which is captivity. So now what most people do and what we have seen work very well is that once they have coverage on their skin, we release them. We give them that Bravecto so they have some coverage, and then we can actually watch them and see that it grows back much faster. The other advantage to that is that we remember that they have to guard their territory. They have to keep their home. They have to defend it. The longer they're out of it, more challenging it is going to be for them to get their home territory back. So we want to be conscientious of their natural history and their behaviors, as well as their treatment and their veterinary care. And it can be stressful. It can impact a lot of everything that happens with them. But again, it's one of those things that the treatment is very effective. And for that, I'm very grateful because it makes a big difference for these guys. All we have to do is trap them. Okay. So these guys, one of my pictures wasn't in here. So these guys are 3 babies that were completely bald. They had no hair at all. You can still see their ears a little bit misshapen there. They all grew back uneventfully. They did great. Interesting thing about these guys, one of them happened to be an intersex. So we had a male, a female, and one in between. Not our call, went right back with his parents where it belonged. We treated the whole family. But they went from bald and crusty to looking like this and getting back out in the world where they should be. So easy to treat, hard to catch them. If you can catch them, give them the best that you can, treat them, get them in and out as quick as you can. Remember that they've got to go back and defend that home territory. And I really do encourage people, if you do rehabilitation or you work with rehabilitators, do everything you can to trap these guys and get them treated, because we can turn them back out. They can have the same life expectancy that they started with. So that's pretty good. Thank you very much.
Awesome. Thank you so much, Lisa.
You are welcome. Go and see the chat. Okay.
All right. Awesome. So we are already getting a lot of questions. Those presentations were fantastic. Thank you. Thank you so much.
Yeah, and thank you, Jamie. That was really good. I really enjoyed that information as well. Cool. All right.
Yeah, thanks everybody, and thank you both. It's great information to share and have. And also just kind of reiterating, I don't know if there's folks here from just the general public, but a lot of the information here presented from a medical perspective is also really important for those in like the rehab or veterinary industry, and not recommending the general public, kind of do some of these. And some of these medications are prescription only, and can adversely impact non-target animals, which we've almost experienced with kit foxes, with some of the mange by mail programs, where people were trying to give a coyote dose to a kit fox that weighed about 5 pounds. So luckily we were able to intervene and help those animals out. And state laws are also kind of different between, who can treat in the field versus rehab. So just kind of keeping that in mind.
Very important points. I'm going to start with this question. Is mange an invasive species, or was there mange before European colonial invasion? Jamie, do you want to take that one?
Yeah, I mean, I don't think there's any data to show either, just because the information that we have for a lot of manges kind of came out with a lot of observational data. I haven't talked to, anybody that might have historically been here before European colonization. My guess is that it could potentially have been here, although its lethality and its impacts to wildlife definitely do become documented and noted in the 1800s. And I also just kind of want to point out that, yeah, these infections have been documented, in Europe. And we kind of know with wildlife pest management that anytime you introduce a disease, um, that sort of means bad news for a lot of non-target wildlife. And so luckily we're kind of moving away from those practices. But from what we know, the disease was here and was observed to be fatal. And then kind of as we start to get written word out and documentation of it, is when researchers like us can kind of go back in those records. But historically, like trapping records have been looked at, furs from trappers have been looked at, and like bobcats and other species to go back and see if they've had mange as well. So I don't think we know the answer to that question, but we know it has been around for a long time, especially in people.
Okay, great. And then is there anything being done to treat the San Joaquin kit foxes who have mange?
Yeah, so we are. We've got a group. We've been treating them since it first was detected in 2013. And so I did genetics for my PhD on that to kind of try and find the origin, which is something similar to what was done in Australia and wombats, as well as in parts of Europe where they were just trying to find the origin. From what we can gather, it was likely coyote, but the genotype the mite shared was close to also domestic dog. So it could have been maybe an introduction from any of those two species, but now it's just kit fox to kit fox. So we are trapping and treating foxes. We have been documenting the disease and have shown, unfortunately, kind of with this haphazard just trapping and treating as cases are reported, it really hasn't done anything to stop the epidemic. But at least we're trying to save those foxes and their pups because, as Lisa also showed, a whole family group could be taken out just through the transmission and co-sharing and communal denning of the species. So a lot of researchers are working with a lot of other groups too, because there's new species, unfortunately, sort of coming online with infestations. And so a lot of our work right now is voluntary. And you can check out like the Endangered Species Recovery Program. We're doing our best to try and save and curb this at least mortalities in kit foxes.
Okay, great. Um, have there been any studies on what happens after the meds wear off, and do they just get reinfected?
They do
Lisa?
for us, yeah.
Yeah, they do. And so we did when I ran center in Toronto, and we did so many coyotes, and we ended up having to tag them just to see if we had repeat offenders. And we had quite a few repeat offenders, but there were so many there. We released them back into an area with a healthy population. We wanted to know where any of these are, and a number of them were. So it was enough for us to know that. Can I also comment too? I just want to make sure that this is clear because I saw in the comments when I'm saying that there's immunocompetence plays a big role, understand that it's not just that. Like you can be extremely healthy and perfect in a normal time of year with all of your resources and get mange. It's just that if you're immunocompromised, it's a whole different ballgame. But it's not that you're safe if you're immunocompetent, right? Anybody can get mange if they have might.
Awesome. Somebody asked a question about capture myopathy. Is that does that come into play?
It always comes into play when we have these guys captive, but when we look, I mean, we would have to look at that and weigh that out against every single animal that we have in care for anything. With regard to capture myopathy for these guys, as far as I know, there has been no correlation between like white muscle disease specifically with mange. Now, you get a really wild adult and you keep them in captivity for 3 months, that's a whole different thing. But with regard to the correlation between mange and capture myopathy, not that I'm aware of. Is there a direct correlation?
Next question, how do you treat an immediate environment where animals may have been, or even humans, to destroy the mites on or in the ground and the eggs to keep the disease from spreading?
Oh, Jamie, do you want that one or do you want me to?
Yeah, I mean either or. I mean we're just trying to clean up the environment. There are like some treatments that you could do, just desiccating high heat, and drying of the area and removing any like infectious materials, like any crust that you might see, or if it's loose bedding. if it's something you can wash, just high heat, because when we deal with it, we have blankets that these animals have touched. We've got gloves, and so we just bleach it, wash it in hot water, and then just the highest setting. For dens and things like that, that is like a whole other issue that we can't. Almost treating in the field is difficult, but if it's a home infection, then just cleaning everything really well.
The other side to that, if you're working in a clinic or a rehab situation, we give our animals a lot of things as far as enrichment and bedding and try to create a habitat that, is as low stress as possible. When it comes to these guys in the first 48 hours, if you actually look at how long the mites live post treatment, there's a range. There's nothing actually concrete with this species and this mite, but there's a range, and it's usually within less than 48 hours. And so typically we try to encourage people not to use anything with those animals that goes into the garbage. So we try not to use hay or straw or paper towels or newspaper. We don't want to do anything that we can put in the trash, because the trash goes into the landfill and it can live for a while in the environment. And we don't want to infect animals that way. So typically what we would do is we do only things, like Jamie said, things that we can throw in the wash. So we will use towels and sheets and blankets until 48 hours. And then after 48 hours, they can have their straw and their branches and all the other things that they can have. But we try to make sure that we're being respectful of that. And that's how we keep our people safe too.
Got it. We have so many great questions that we just don't have time for, but there's one more that I want to address. What kind of advice would you offer to animal control agencies in addressing concerns with moderately infected wildlife that seem still otherwise able to perform normal daily living functions overall? And I'm going to say, go ahead and reach out to your local wildlife rehabilitator, Animal Help Now. I believe Amelia has shared that link in the chat where you can find a rehabilitator near you. And I don't know if if you guys want to jump in about
Go
that.
ahead.
Okay.
So what I would say is that if you have an animal that looks to have mange that is still fully functional in his daily life, that is the time to trap them. Do not wait until the point where they're more severely compromised. So the fact that you see mange on them is enough to make the effort to trap them. Don't wait until the 11th hour. That is actually going to be the target time. Just make sure that you have somewhere to take them as you're in an animal control situation. That would be, I think, the best advice. That's when we want to get them, when it's early and easy to get back out.
Right. And some states it's illegal to rehab coyotes, for example.
Yeah, some states and some parts of some states, right?
Yeah.
So, yeah.
Yeah, and one of the things I'd like to add to that, and even when I worked for the agencies and trying to make the plea for why we should treat coyotes, not just from like an ethical and a welfare perspective, but the concern being novel spillover into a new host, because the more coyotes you have running around that aren't getting treatment, the more opportunities you have for a spillover event, which essentially is the mites being transferred from a coyote to a different host of a different genus. And that's a concern, especially when talking about threatened and endangered species. And that's a concern worldwide. And so those have been our arguments, even internally, but I can't speak for the department now. But yes, yeah, state laws might sort of prohibit such activities. And so it's always important to make sure that, you're working with your natural resource or wildlife agencies or animal control.
Awesome. Well, thank you both so much for your time and your expertise. Thank you, everyone who's joined us. And thank you, Amelia, for helping behind the scenes.
Thank you, everyone.
Thank you.
Like I said, this will be recorded and we'll share the link out so you can watch it again or share it out to your community.
Thank you.
Thank you, everyone. I'm going to go ahead and end the webinar now.
Awesome. Thanks, Amelia.
Thank you, everyone.